Hello, thanks for joining us today. We're going to be talking about spinal stenosis. Now, spinal stenosis is commonly called a narrowing of the spine or narrowing of the spinal canal. And there are two areas where the spinal canal can narrow. One of them is in the central canal, and that's called central stenosis. That's where the spinal column, or the actual spinal cord itself, goes through. The other is called foraminal stenosis, and that is where the vertebral foramen, which is right here, these openings where the nerve roots come out. The most common cause is arthritis. Now, aging will cause a loss of water in the disc, and this is the disc right here. All right, that loss of water will cause a settling or loss of height in the disc. That will cause two things. One is the weight will transfer from here back to here. These are called the facets. And that transfer will cause a narrowing of these little tunnels or the foramen where the nerve roots come out, right here. Now, that transfer of weight to the facets will cause some degeneration and cause some arthritis. Now, there are, of course, other causes, such as bone disease like Paget's or achondroplasia, bone spurs, spinal tumors, congenital spine defects, herniated or slip discs like this represents, or injuries causing pressure to the nerve root, which would be right here. Now, this most commonly happens in the low back. Now, some of the symptoms would be low back pain, numbness, burning sensation, or weakness in the legs, feet, or buttocks would be one of the main symptoms. Also, the symptoms would be worse on standing or walking, especially walking uphill. And they can diminish while lying down or leaning forward. There are a couple of very serious symptoms you should be aware of. One of them is difficulty with balance, especially when walking. The other is bowel or bladder control problems. And if you get either of these symptoms, you should immediately contact your doctor. Now, the test that your doctor may perform would be to have you sit, stand, or walk, have you walk on your heels or toes, bend forward, bend backward, and or sideways while standing, have you lift your legs while lying on your back, or the doctor may lift them for you. And the doctor may also require an X-ray, a CT, or an MRI. Thank you for joining us today.